Stanford University.
Welcome to Stanford Medicine's 12th Annual Contemplation by Design Summit. I'm Dr. Tia Rich, founder and director of Contemplation by Design, and it's my distinct honor to introduce our next speaker, Dr. Mark Greenberg, who will be providing a keynote session titled The Science of Nurturing Well-Being in Children and Their Caregivers, including their teachers. Mark Greenberg, PhD, is the Emeritus Bennett Chair of Prevention Science at Penn State University. He is one of the founders of CASTLE. He is the author of over 350 journal articles and book chapters on the development of well-being, learning, and the effects of prevention efforts on children and families. He is the chairperson of CREATE, a nonprofit devoted to improving schooling and the lives of teachers and students. Join me now in warmly welcoming Dr. Mark Greenberg.
Thank you, Tia. Glad to be with everyone today. I'm going to put up my slides, and I want to first tell you the roadmap of what I'm going to talk about today. Briefly, I'm going to talk about broad issues in mindfulness and compassion education, just what the rationale is for this. Then I'm going to talk about mindfulness for educators, and both a curriculum I've been involved with and the larger field. And after that, I think I'll stop and take questions before we go on to mindfulness for students and what I think of as next steps from both a science and a practice standpoint in this field. But just to disclose, some of these things Tia already said. I'm the board chair of CREATE. It's a nonprofit, and I'll be talking about the CARE curriculum today. I'm an emeritus board member of CASTLE, and I receive royalties from the PATHS program, which I probably won't discuss today. In addition, I should just disclose I'm a long-term meditator. I've belonged to an ashram since 1986, and I follow the Advaita path of Ramana Maharshi. So I have my own interest in this as a person who believes it has powerful effects, but that is separate from the science I'm going to talk about today. So I start with sort of my convictions about these things. I think awareness, sympathy, and compassion are core dimensions of human nature, and that we can nurture them. Of course, attention is an important factor there too. And when these are nurtured, they enhance one's personal health and well-being. And I'm particularly interested in the issue of personal health, because we mostly have been looking at things like psychological health, like depression and anxiety as outcomes, or rumination, or we've been looking at behavior in the classroom, maybe academic achievement. But we've rarely looked at physical health outcomes, and I think those are important both from a policy standpoint and from a scientific standpoint. When we nurture these things, they also create positive connections to others, and when that happens, it also creates well-being in others. So this is not just a personal, individualistic issue in my mind; it's one about community. And I believe if sympathy, compassion, and awareness are nurtured as human values, it'll also affect the quality of our natural physical environment. And here I'm talking about issues around climate change and other related modern issues. So I think there's a broad agenda here. And so let me sort of just give what the broad agenda is. The practical outcome of this kind of comprehensive program of awareness and compassion and mindfulness would be, first of all, we would develop clear developmental and ecological models of the growth of empathy, caring, and compassion. And we don't have those right now. There's very little good developmental research. There's some on empathy, of course, Nancy Eisenberg's work to be most noticed. But there's very little work on caring and compassion in children and how they develop over time, what factors influence it, how we can change it. The broad agenda I'm talking about will also lead to effective policies and programs and practices that support the development of caring, compassion, and service to others in our schools and communities. And right now we have very few effective policies for sure, maybe some programs and practices. And as a result of that, I think children, youth, and adults who show greater service to others, as well as caring about the preservation of the Earth's ecology, I think it's a critically important outcome. although there's been very little work so far in children or in youth connecting mindfulness or compassion to issues around climate. So, given that broad agenda, I have a broad question: is how do we promote caring and compassion? And so what does it mean to be caring and compassionate? And I think there's a couple characteristics here. One is to be attentive and aware. And we know developmentally this issue of the capture of attention and the training of attention is a critically important part of what can be considered mindfulness practice. Many of these are what we consider to be social emotional competencies: sensitivity to others and their needs, being open-minded, what we call deep listening, or trying at least to listen without judgment, not easy for any of us to do, recognizing our common humanity, and acting from a ground of ethics, an ethics of do no harm. I think those are critical to being caring, compassionate. So the question is, in what ways can this broad agenda and this broad question, how can we effectively promote these skills in schools and families and students? And not just in what I'd call boutique form in wealthy private schools that are all interested in these kinds of ideas, but in normal public schools around the world in many countries. So this began for me as a journey. Even though I was a meditator for a long time, I was involved in the 2000 meeting of Mind and Life in Dharamsala, which was on how can mindfulness and contemplative practice nurture meaningful change in education. And at that meeting, I said to His Holiness that one of the important things I thought that was an issue is that there was not a university in the world that taught teachers about children's social and emotional development. We weren't even talking about mindfulness and compassion back then, but even children's social and emotional development. And that's changed somewhat, but I think we have a long way to go in teacher and administrator training if we want to change the nature of schools. This is a slide from Rod Roser, one of my colleagues, that starts, as you can see, with the curl of that line in 2000 with destructive emotions. And you can just see that there are many things that have happened since then. There have been many meetings. There have been the development of handbooks. There's been the Garrison Mapping Project, which I was the chair of. There's the development of programs themselves, and this has just continued. There's enormous growth. There are very many people interested in this problem, and many believe that using contemplative practices is a critical change for schools around the world. So, nurturing mindfulness in schools is a field that's changing rapidly. There are lots of new ideas, which makes it a fascinating field because many ideas are coming to fruition. We're now beginning to see high-quality research, and I'm going to talk about that later on. But there are very few well-designed studies, and almost no studies that follow up over time to ask the question: if you do mindfulness and contemplative practices with students or with teachers, what happens 3 or 4 years later? In fact, in the whole field of mindfulness, in which there are maybe 10,000 articles, now we're talking about mindfulness in adults, there are almost no follow-up studies to show that the effects of mindfulness have any lasting effect on well-being or physical health. It's a fundamental problem in our field, and especially with children, this is very important because we want to know not just does it impact them in the short term, but does it have longer-term impacts on the pathways of their development. So currently the evidence is thin. And in fact, if a superintendent came to me right now and said, yeah, I've heard all about this mindfulness work, what should I do? I would say to them that I would focus on the teachers. And that's because of the high quality research in this area and the positive effects. And so I'm going to start by talking about the work with teachers. And we can think about this. There's much yet to be learned about promoting mindfulness and compassion in children. We don't know much. We've used sort of a limited set of practices I'll get back to later, which I think maybe limits our findings. But helping adults, parents, and teachers to become mindful is really essential. And if you affect a teacher's own mindfulness and compassion, you're then going to affect many years of students, many students. And so the impact is powerful. not only because they'll see so many students over time that they'll affect, but because of the systems change you're making. So when I think about a holistic picture, we're interested in the problem of not just children's well-being, but healthy, caring schools. We all want our children, our grandchildren to go to schools that are healthy, caring places that nurture awareness and compassion. I think there's three components we need. One is we need effective, equitable conditions for learning and norms of caring in our schools. That relates to effective discipline problem, teachers' instruction, etc. We need social and emotional skill development for children, and I'll add compassion and mindfulness as part of that social and emotional skill development. But we also need teachers and leaders that have healthy well-being and awareness. If we don't have all three of those components, we're not going to have what I call a whole school systems change. But we're not there yet for the most part, and so I'll tell you where we are. First of all, we're in a crisis. There's a serious crisis of teacher retention in many countries. We read about it all the time. It's been going on for about 15 years or so. It's not just a post-COVID phenomena, but it got worse because of COVID. Teaching is now rated as a highly stressful profession in most countries. This is not just a USA problem by any means, really a worldwide problem. So we need to support teachers' own social emotional learning and their own professional growth. And when you look at the lives of teachers, there's very little research on how teachers grow over time. We know that the teachers in their first couple years struggle. All teachers struggle in their first couple years. But we don't know much about teachers in their 10th to 20th year, for example. A friend of mine who's a teacher said he didn't have any idea what he was doing till his 15th year. And then it really came to him, and he became a better teacher. So we don't know much about this issue of professional growth over time. We don't know if we did mindfulness and compassion work with teachers that are just starting out versus teachers that have had a lot of experience, what the differential influences are. But we know we need broader systems change to support educators. And it's not just teaching them about how to be mindful and compassionate. That can be leading to a problem of blaming the victim, the teacher themselves. We need broader systems change in how schools operate, what their goals are, and how they go about both curriculum and instruction with kids. This is just a summary up till 2024 of how many teachers say they're satisfied with their jobs in America, just to give you a sense of the dramatic crisis that we're in. And that hasn't changed in the last 2 or 3 years. And for well students, we need well teachers. That's the whole point here, right? Teachers at the beginning of the year and at the end of the year. This is a slide from my friend Kim Schoenert-Reichel. We actually did a study of this where we studied the cortisol as a stress reaction of teachers at the beginning of the year and the end of the year. Their awakening morning cortisol response in the morning before they had caffeine. And what we showed is across the year, from the beginning of the year to the end of the year, their physiological wellness as measured by their cortisol, awakening morning cortisol, declined dramatically. They looked like a normal, healthy adult in September, and in May, they looked like a Romanian orphan. So when we talk about this effect of teachers being stressed, it's not just that they feel stress, it's that the physiological system is being damaged and needs repair. And that's why teachers are so exhausted by the end of the school year. So we need to think about teachers not just in terms of their instruction, but about their mental well-being and also their long-term physical health. Tish Jennings and I, about 15 years ago or so, developed what we call the model of the pro-social classroom. And basically, if you look at the right side, the students' social, emotional, and academic outcomes, that's what schools are about, right? We know that that children's social and emotional and academic outcomes are affected by the quality of classroom climate. In fact, we see this even stronger now post-COVID, where many students aren't coming to school very often if they don't feel they belong. And we know that healthy classroom climate is related to healthy teacher-student relationships, to effective classroom management skills on parts of teachers that run a healthy classroom, and also to effective social emotional learning program implementation. But who's doing all this? Who's doing all this work in the first place? It's the teachers. And if teachers aren't well, and they don't have their own effective social emotional skills, then it's unlikely we're going to have healthy teacher relationships, effective classroom management, effective SEL implementation, or positive student outcomes. And so it's really surprising that it's only in the last 10 years or so that educators have really begun to think about what we need to do to bolster and nurture teachers' own well-being. So what's the effect of teacher well-being on students? Well, I could bore you for an hour or two on this, but I won't. But I'll just tell you that we know that teachers who report greater burnout and depressive symptoms early in the school year have classrooms with more behavior problems across the school year. That is, there's a causative influence, it's not correlational. When teachers are highly stressed, children show lower levels of social adjustment and academic performance. And my colleague Kim Schonert-Reichel and Oberle did a study in which they showed that students' cortisol or stress levels were much higher in classrooms when a teacher had been reporting being overburdened or high in burnout. So again, teachers who are stressed are not only affecting children's well-being, but they're affecting their physiological health. And that has long-term implications, I believe. So when we think about mindfulness, and many of you have been on numerous of these sessions during the last 10 days, we think about mindfulness as not mostly sitting on a pillow paying attention. We think of mindfulness in terms of its role in interpersonal context. As His Holiness said to me one day, he said, if you sit on a pillow for a long period of time, but when you're with other people you aren't present with them in a compassionate way, then nothing has happened. And so we think about what we call the skills of interpersonal mindfulness, all of which are more difficult than sitting on a pillow in my mind. Listening with full attention to children and to colleagues, being present, centered in your awareness of your emotions as you're experiencing them and as your students are experiencing them, being open and non-judgmental. Right? You notice I wrote low judgmental because I don't think non-judgmental acceptance is possible for most people, including myself, but being open and receptive to children's thoughts and feelings. Being self-regulated in the sense of being low in reactivity and low in automaticity. So you're not just doing what you normally do. You're actually in the present moment. You're listening. You're low in judgment. You're trying to react to what's actually happening in the moment. And that's hard for a teacher that's got 28, 30 kids in a classroom, right? They've got a lot to do. And then being aware and responsive to children's individual needs, what we call the teachable moments, which at different developmental phases are very different. And in adolescence, it's often when you're driving in the car with them and there's no face-to-face interaction, but the most important teachable moments occur. And lastly, as almost all of these are very difficult for anyone to do, you have to have compassion for yourself and for your students. You have to know that these are intentions that you have to be a different kind of person or a better person, but that you will often fail in the process. So that's what we think about when we think about the indicators of mindfulness in a personal context, which has driven the work of Tish Jennings, Krista Turksman, and Richard Brown, who created the CARE curriculum, which I'll talk about, under the aegis of the Garrison Institute. Is really I think the first real teacher mindfulness and compassion program that was developed, beginning in really following from the meeting I talked about in Dharamsala with His Holiness in 2000. And one of the goals, of course, is reduce this burnout cascade of teachers feeling emotionally exhausted, which many of us feel emotionally exhausted, but we love our work. But when you get to what we call depersonalization, when you start to see students as out to get you, as they're behaving badly towards you because they want to hurt you, this happens all the time to teachers and happens to parents. Then you begin to feel a total lack of accomplishment as a professional or as a parent. And this is the burnout cascade that leads to attrition, of course, teachers leaving the profession. So in CARE, the intervention aims are to increase teachers' well-being by increasing their mindful awareness, their positive affect, their sense of efficacy and enjoyment in the classroom, and decrease their burnout and negative affect. Care has been done a variety of ways in a variety of contexts. It's usually done as 3 to 5 days of sessions over 1 to 3 months. Usually it's done as 18 hours of professional development. Think about that over a 3-day period. And either there's online or phone support or email support, depending upon the context. And one of the goals is for the teachers in the workshop to develop a sustainability plan for themselves at their school. There are 3 main program elements to care work. First is mindful practice. And those are usually simple practices. Of course, we teach them to do some of the traditional mindfulness of emotions and mindfulness of breath meditations. But you have to be realistic. There's very few teachers that are ever going to meditate on a regular basis. It's just not feasible for most of them, let alone many of them are not interested in that. And in fact, we know that adults that even go to MBSR or other programs don't regularly meditate afterwards. Very few people maintain a regular practice. And so our intention in this program is not to help to have teachers feel like they have to maintain a regular practice, but instead to use mindfulness as they can in the present moment, and interpersonally. Maybe by taking 3 deep breaths when they need to, which teachers say is the most important practice they do. Setting intentions in the morning about how they want their day to go. Mindful walking or being centered as a teacher in the classroom. The second component is emotional awareness, and that has to do with lots of different aspects of emotions, recognizing your own emotions and how they arise in the classroom, especially anger and sadness, but also positive emotions. And also to recognize the scripts that you might have about children, about the way they look, their color, their name, their backgrounds, and how those biases may influence your awareness. And then lastly, in the care program, we work on empathy and compassion for both ourselves and others. 2 main practices that are most important are mindful listening or deep listening, listening without judgment, without a need to reply, and a caring practice, or what many people in mindfulness call metta practices. So those are the 3 components done over usually 3 days. We have findings from care from multiple randomized trials in rural and urban U.S. The rural and urban was in Pennsylvania, and then we did a very large trial in New York City, in the Bronx. A separate trial has been done also in Zagreb, Croatia. And basically the same findings are found in each study. One is that teachers report lower stress. These are randomized trials, by the way, of volunteer teachers. It's important for me to say that they were volunteer teachers. They have higher efficacy in teaching. In all the studies, we find a less sense of time urgency. They feel less rushed, even though there's nothing that's changed about their daily work, because this does not affect, it's not intended as a curriculum for them to do with children. It's just a developmental process for them as adults to develop their own mindfulness and compassion in their work. We see lower rates of depression and anxiety. By the way, these are all significant effects statistically. In the Zagreb study, the only one where we measured it, we showed a greater compassion for both self and others. And we see a lower rate of physical symptoms of stress. In the New York City study, we sent observers blind to the condition to about 220 classrooms, and the observers noted improved quality of teaching, both in the emotional atmosphere of the classroom and the productivity of the instruction. So interestingly, it affects teachers' instruction, even though we're not teaching them anything about curriculum or about instruction. But wouldn't you think that makes sense? Wouldn't you think that if teachers felt more present, they felt more compassionate, they felt more with it in the classroom, that their instruction would be better and children would bond to them more and build a healthier classroom environment? In the New York study, we did longer-term outcomes. We found that teachers trained in care compared to their randomized controls a year later continued to have a benefit with lower psychological stress, higher reports of self-reports of mindfulness, and higher reports of adaptive emotion regulation. I don't know any studies that have followed teachers more than a year, so we don't know what the long-term impacts of these are, but they seem quite promising. We also studied 5,200 students in the New York City study that were in those 224 classrooms around the Bronx. And we found that by teacher report, the kids in the intervention, the care classrooms showed greater motivation, greater classroom engagement, and higher reading competence. There's only one other study that I know of that's been done in the world. It's done in Portugal. It's actually looked at student outcomes as a result of teacher mindfulness, and they also showed positive outcomes on social and emotional development. So some tentative conclusions. Teachers are stressed. It affects their personal lives as well as their students and the quality of their instruction and caring. Teachers find mindfulness compassion training feasible and they like it, but don't expect that they're going to become meditators in a traditional sense because they don't have any time. They have no time to do this. They have children. They have adult parents. They have a very stressful job. They work approximately 52 hours a week on average in America. They are really overwhelmed. And the idea that most of them, except maybe I would say 3 to 5%, are going to meditate on a regular basis is unrealistic. And so we shouldn't lead them to believe that that's necessary. As we've shown in the care studies, it's not necessary for them to become more caring, compassionate, and enjoy their jobs better. When teachers become more mindful, they enjoy their jobs better, they feel better, and they improve in their health, and they provide better instruction. What else could we ask for? These are the things we want our schools to be like. But combining child SEL models and teacher SEL models in the same school at the same time is something that really we have almost no data on. And I think it's one of the next steps in what I'd call creating caring schools. So nurturing educators' own resilience to support the challenges of teaching. I gave you the example of care, but there are now many meta-analyses. There are almost as many meta-analyses as there are studies. So you can suspect that some of these meta-analyses are not great. Because they don't probably have a large enough base. But they've been done in Hong Kong, they've been done in Australia, they've been done in the United States. And these are just 3 examples of the many meta-analyses that have been done, all pointing to the fact that if there's one thing we know about mindfulness, it is helpful to teachers. It changes their behavior and their enjoyment of teaching. So what are the rationales? Now I'm going to go to a superintendent of a school district or a school board, and I'm going to say, what do you gain from having educators who are resilient, involved, and flourishing in their jobs? Because they want practical outcomes. They don't want just the teachers feel better. This is not a policy point in the world of education in this world. Well, it's proven teachers will have greater well-being, and this is not just the care study. This is the many studies that have been done. Teachers will show better instructional practices. We know a little bit about that. Students will be less disruptive and have better attention. That looks like it's positive so far. And students, I think, will feel included and valued. I think we've proven those. But what we've hypothesized, but we don't have sufficient data on, are school savings. We really decrease attrition. It costs an average about $15,000 to $18,000 a year in the United States for a school district every time a teacher turns over. It's a big cost issue. School savings from teachers' physical and mental health costs. We don't know if when teachers are well, if they are less likely to have the aches and pains that lead them to go to urgent care, to see their physicians for psychosomatic illnesses. We know that a large percentage, about 20% of women in America are on antidepressant medication in any day. We believe it's much higher in teachers who are mostly women. We don't know if in improving their well-being through these programs will lead to decreases in medication, its effects, and medication costs. We don't know much about teacher absenteeism. We know teachers take a lot of mental health days, and that's a big cost. As you know, if any of you have ever been interim teachers, that the salaries for those have gone up dramatically. It's a very big school cost. And so we have school savings from teacher turnover, school savings from physical and mental health costs, school savings from substitute teachers, and we don't know much about any of those. And that's where the rubber meets the road. If you want to convince a district that this is worthwhile, you have 2 options. One is to prove that it improves children's academic achievement, and the second is to prove that it lowers their costs. And of course, the last one, I think, in some ways is the most important over time, and that is greater teacher stability means greater community stability. And that's very important because we see a revolving set of young teachers, mostly in the most disadvantaged schools, not only in America, but in other countries. And they revolve, and this creates greater community instability and lower learning outcomes for the children that are most disadvantaged. So I think I'll take a break there. I've told you a lot about this topic, and maybe we can take some questions on the issues of sort of mindfulness and compassion for teachers. People's thoughts, comments, questions about the work.
Thank you, Mark, for this very illuminating overview. And our first question is with respect to the hypothesis that there would be school savings related to the physical and mental costs being reduced. We wonder if there have ever been any studies that take de-identified data from the district insurance claims to just track the individuals who went through the care training to see if there are any trend lines evident in the insurance claims.
Well, that's a great question because it's what I've been thinking about for quite a while, and no one has done it. Mm-hmm. Most of the studies are relatively small, the CARE study being one of the largest in New York study of 220 for teachers. But getting this kind of approval for HIPAA approved access to their files is really difficult. It's easier for disadvantaged students to look at their files because they're all on Medicaid, and Medicaid files can be made available under very controlled conditions. And I've also gone to school district superintendents and talked to them about even independent of an intervention, just looking at what their costs are in insurance benefits, and how it might vary. For example, take a school district like Cleveland, might have 80 schools. And we know that some schools are functioning better than others in terms of children's outcomes and maybe teacher attrition. But we don't know anything about how it's related to the physical health of the teachers or the insurance costs the districts incur. This issue of insurance and health benefits is one that it's sort of arcane, and it's very hard to explore. Yet I think it's one of the most important kinds of data that would be convincing to create policy change. And that's what we want. We want something big, which is policy change at the level of districts.
Mm-hmm. Well, thank you for addressing the complexity of accessing that data. And in a similar vein, could you address the complexity and reasons that the data on attrition is not yet able to address the hypothesis?
Well, it's just a matter, remember, I mentioned that I think the CARE study is the longest study now of teacher outcomes, which is only a year and a half after the intervention. And so you'd have to expect that attrition is going to occur over time. And it may be 3 to 10 years until you'd get enough data where enough of the control teachers would have attrited that you could actually see a difference. And so these are really important policy issues, but we have not gotten the funding or the context in which we can study these carefully. And yet, in the end, of course, if we really want to have whole school change, we need to have this kind of information.
Mm-hmm. You likely are aware that Tim Ryan was a champion for social emotional learning, and I wonder if you can speak to any policy initiatives that were offered at the national level that might have impacted the availability of funding in a positive way.
Well, I think, Castle, Tim Ryan, and others were really influential in developing the review group at the Institute of Educational Sciences on social emotional learning, and which included the funding for many mindfulness studies in schools. Unfortunately, under the current administration, this review group's been completely scrapped, and there will be no funding, I would think, for the next at least couple years in this field from the federal government, which is going to take a long time for us to repair, and at a time in which we know that teacher stress and child well-being are both at I would say just about its lowest point that we've seen in the last couple generations.
Thank you for speaking to this important topic. Could you speak to what you are aware of internationally? You mentioned that some of the research has included some international cohorts. Is there any terrain in a country that you could point us to that is still funding research and is addressing the whole pro-social school, pro-social classroom paradigm?
Yeah, this is what's most fascinating to you about this. This is only in the United States. Only in the United States. And in fact, social emotional learning and these issues around mindfulness and teaching are growing dramatically all around the world. It's only in the United States where we have this has been made somehow a political issue. And it wasn't a political issue even in the first Trump administration. It's only in the second Trump administration this has become a political issue. And what you see is a dramatic growth of research on social emotional development for children and for teachers all around the world. In fact, I'll address that a bit more later. But there are already, in the last meta-analysis done by Chris Cipriano at Yale, there were randomized or quasi-experimental trials in 54 different countries. So there's enormous growth. And a day doesn't go by that I don't receive a letter from someone in Turkey or Pakistan or Afghanistan, places you wouldn't even think were thinking about social emotional learning. And of course, it's very dramatically used in most of the Western countries of Europe and Asia.
Mm-hmm. Well, thank you for holding up the promise that lies outside the U.S. You've also elevated our awareness of the absence of rigorous data on the arc of development of social and emotional qualities in just normal development of a child. Is there similar progress being made internationally on providing an ecological model of emotional development?
Well, there's a fair amount of emotional development generally, and there's a fair amount on most of the CASEL competencies. But I think it's more specifically in the issue of compassion and mindfulness that we don't know very much. So, for example, I'm going to be a skeptic here. I'm going to take the devil's advocate view, and I'm going to say that there is no intervention that I would call mindfulness before children are 11 or 12 years of age at the earliest. And that's because they don't have metacognitive skills. And if we consider mindfulness to be a metacognitive skill, which is fundamentally about understanding the nature of mind, of your own mind, and being able to watch and observe your own mind, I don't think that mindfulness occurs developmentally before that period. And I would call most of what we call mindfulness interventions for young children just classic social emotional regulation interventions. I know we call them mindfulness, but I would actually call them proto-mindfulness. Mm-hmm. And this is part of the issue, is we don't understand much about the development of these skills of metacognitive awareness of self and other at early ages.
Mm-hmm. And what I'm hearing is that there needs to be a more robust lexicon of the components of mindfulness, and
that's right,
and how each component is available at a different developmental stage for a child to learn. Could you speak more deeply into this, given the work even recently at the School of Education at Stanford? There was a study on breathing and separating out from the metacognition parts of mindfulness the process of developing breathing skills to just focus on the breath as an attention, concentration practice, and then extending the exhalation as a relaxation practice.
That's right. So this breathing is a perfect example of a skill that is not, we wouldn't say that learning to breathe is becoming mindful, mm-hmm. right? I don't think that would meet the criteria. But breathing is very important. In fact, in our own work, starting in 1980 with the PADS curriculum, the first thing we teach young children is what we call doing turtle, which is stopping and calming down by taking deep breaths. Mm-hmm. In fact, I had His Holiness the Dalai Lama do this with me in 2000. And breathing is a perfect example. And I think yoga, this is I know you had the Holistic Life Foundation group on earlier in this conference. I think yoga is a perfect example of a skill that can help kids develop self-regulation at almost any age. I don't know if it creates mindfulness or not. and part of that's how we would define mindfulness, I think. But it clearly creates children's abilities to regulate themselves, to become aware of their proprioceptive feedback in their bodies, and to relax and be calm. And those are all powerful, important variables that predict children's well-being and learning across time.
Mm-hmm. Thank you very much for addressing the component parts and the relationship among them. I think that's where we are with our questions at this time.
Sure, I'll pick up. Mm-hmm. So let's go to kids a little bit. Well, the implications of practice are pretty clear. Teacher SEL works. It's doable. It needs support. But what about children and youth? This is more complicated, as we are already discussing to you. The Castle model, as many of you know, has these 5 components: 2 intrapersonal, the red ones; 2 interpersonal, the blue ones; and responsible decision making. Many years ago, and of course, it's not only about the skills themselves, but the quality of instruction in the classroom. It's about school-wide practices and policies, Castle's model, and about family and community partnerships, thinking about a whole school model. And the newest meta-analysis I mentioned, SEL, shows that programs, SEL programs, show high effectiveness. I did a report for the Learning Policy Institute a couple years ago. This is you can see the number of meta-analysis. These are hundreds and hundreds of studies showing effect sizes that are important and strong from a universal standpoint for skills, behavior problems, emotional distress, and performance, academic performance. And we know that the most effective programs are sequenced. Children are active. They are focused on specific skills, and they teach the skills explicitly. They're delivered by teachers in the classroom. They focus on both skills and classroom climate. They integrate SEL into academic content like reading, math, and they have high-quality implementation. That's what we know about SEL programs in general. And there's a new field. Rob Roser has been the major purveyor of this, contemplative developmental science, which is really what we've been talking about. What are the developmental processes involved in the growth of mindfulness and compassion? What are the developmental features that we might be able to use with a 6-year-old, but not with a 9-year-old, or maybe with a 12-year-old, but it's different with a college student? And then understanding the development, implementation, and efficacy of secular mindfulness and related trainings in schools and community settings for children, adolescents, parents, and educators. This is the new field, contemplative developmental science. You can find some articles that would extrapolate this much more. So Rob and I, many years ago, took the Castle wheel and we started to think about how it is that contemplative deepening might occur. As what had Castle not really dealt with very much, that's part of the nature of mindfulness and compassion, that by doing contemplative practices, we might deepen. So, for example, in self-awareness, it's actually understanding the nature of your mind, which is fundamental to mindfulness work, right? And also maybe a sense of deeper emotional awareness. In self-management, it's really what we call inhibitory control, or there are lots of neuroscience names for that these days, but it's really about how we inhibit our behavior, our prepotent responses, and also the deployment of attention, how we deploy attention over time. In social awareness, there was very little discussion of the word compassion. In the past, people talked about empathy. We now know from good neuroscience work that empathy and compassion are not the same things, and that compassion obviously has the additional aspect of a desire to take action to help others. And so I think that we saw in the past a number of SEL programs focused on empathy, but very few on compassion. And now we're seeing the development of new ideas here. In relationship skills, the idea of deep mindful listening, which has been not part of the fundamental skills of SEL, thoughtful dialogue, and new ways of learning to manage conflict, I think, that we see coming out of the mindfulness and contemplative field. And then lastly, with decision-making, being able to state facts without judgment, just being able to state the facts. and making choices that are based on a sense of ethics. Now, the growth in SEL research is dramatic. There are so many papers. I have to say a lot of them are not very high quality, but there's a lot of work in this field. And the field's very new. School-based mental health, mindfulness programs have outpaced the research on program effectiveness. There are lots of true believers. There are many, many nonprofits, almost in every city in America, that are doing this work and believe it has enormous effects on children's outcomes. There's some evidence that it improves children's mindfulness and self-regulation skills, but it's not very strong evidence. There's some evidence that it reduces students' feelings of anxiety and depression, but very little evidence. There's no evidence almost at all that it reduces students' aggression or improves their well-being. And most of the studies are poorly designed and very few are independent, as they're done independently of the believer who's doing the intervention. And that's really important that we have independent studies that are carefully designed and carried out. Unfortunately, in the past 3 or 4 years, we've found that mindfulness use is having no or very small effects. Now, when I say this, these are programs that are designed programs, curriculums. And the new independent, well-designed studies with preteens and teens basically have been showing no effects. The Myriad study in the UK, in which I was an investigator, the Julie study in Denmark, the Aguera study in Spain, the Holopainen study in Norway, the Frank study, which I was also an investigator in the US, the Taylor study in Canada, the Bogart study in Belgium, and Johnson and Wade with multiple studies in Australia. This is sort of shocking. I was one of the people, as a long-term meditator myself, I thought that adolescence was a perfect time. It's when kids ruminate, they have a sense of metacognition, they can now begin to understand the nature of their minds. But the studies, while there are small studies that have shown effects that are in those meta-analyses, when you start to look at the large major studies that are carefully done with sufficient samples, they're not showing effects. No effects at all, or very, very small effects. So why? Why are there no effects in teens? We're all thinking about this now. It's a conundrum. Now, I would say there's a couple of reasons, maybe. One is there have been mostly mindfulness studies teaching kids traditional mindfulness practices and not really focused on compassion and ethics. Okay? And I think mindfulness studies alone are probably not sufficient from a social emotional learning standpoint, because I think there's very little chance that just having children learn mindfulness practices, traditional mindfulness practices, mindfulness of breath, mindfulness of emotions, body scans, etc., are going to lead children to be better in their peer relationships or manage conflict better with their friends or their parents or their teachers, or persist in their academic work, because those practices don't contain a way in which that it would lead to better peer relationships or persistence at work or managing conflict. We have to teach those skills explicitly for them to have an effect. The second reason is they're mostly short programs. They're 8 to 16 weeks. And we've learned in the social emotional learning world that SEL programs almost are never short, because they don't work that well when they don't last. And the third reason is teachers may not be sufficiently trained or embodied, and this is an issue. I think in many of these studies they really do a yeoman's job of trying to do this by having teachers often in these studies have their own mindfulness program practice before they learn the specific program. So, for example, the Myriad, which is the largest study, almost 90 secondary schools in the UK, the teachers had their own 8-week mindfulness practice, like you have in an MBSR sort of model. And then they have 4 days of training in the .B program, which was the program used there. So that's an extensive amount of training. If that doesn't work, then we need specialists. We need mindfulness specialists that would come in and do this kind of work. And then the question is that sustainable? So we have but why no effects in teens now? Teachers may not be sufficiently trained. We don't know if that's the reason or not. I'll tell you what I think the biggest reason is: it's not voluntary. Students haven't chosen this. It's mandatory. I said once at a meeting with John Kabat-Zinn that we have to think of schools as jails or prisons where children don't have choice. And this is very different than the studies we see with adults, which are almost all volunteers. Volunteers because they're suffering in one way or another, physically or mentally, or college students in which they volunteer for these programs. In this case, universal programs in schools, students don't have a choice. It's not voluntary. And teenagers are quite likely skeptical, especially if they're feeling jaded about school in general. And who doesn't know adolescents who are feeling jaded about school in general? Okay. Lastly, there were self-reports of this, and we just published a paper from the Myriad study. There's a lot of students find it just boring. And in some cases, they find it disingenuous. Example of a quote from a study by Crane in England, who did a qualitative analysis of teens' perspectives on mindfulness, is a teen said, "Look, I've got real problems and I've got real emotions. And the mindfulness teacher says I should let them rise and pass away, but I want to talk about them." So there's a lot of reasons why there's a poor fit, and it may be any of these reasons or more. If you're interested in reading more about this, there are critiques by Johnson, by Strohmeyer and Bailey, and Gala. These critiques by Johnson, Strohmeyer, Bailey, and Gala are all worth reading. They all talk about why they think that these programs have failed to be successful. But a larger reason might be, remember I showed you that diagram of a healthy school? You've got teacher well-being, you've got child social emotional skills, you've got norms of caring and good instruction. And so a group that was led by Deb Schuessler and Sabrina Doyle-Fosco held a series of meetings funded by the Spencer Foundation on this issue, and they call for what they call full whole school mindfulness. Just like we talk about systemic SEL, where we want to affect everything. We want to affect not only the teachers, but the administrators, parents, the accountability systems, et cetera. In the same way, that's true here. There are very few examples of this. There's one by Scheinman in Israel, and I actually visited this school. It's an elementary school in which the principal was the same principal for 15 years, developed the trust of all the teachers. The teachers all went through mindfulness, and then they hired a mindfulness teacher. And each classroom with their teacher would go into the mindfulness room with a mindfulness teacher each week, do mindfulness practices, mostly yoga because of the age of the kids and some shavasana. And then they would have activities that would carry on back in their regular classrooms. It was quite an interesting model. Can it be replicated? That's the question. The Holistic Life Foundation is trying to do something like that through the Clinton Global Initiative. They might have discussed this in Milwaukee and Denver and other places. There was a presentation yesterday by the Crockett School, a school in Phoenix, Arizona, that is doing this. The question is, can this grow to scale? That's a fundamental question for us. And first of all, does it work? That is, all three examples I've given you have no control groups. It may be that everything looks better in these schools, but it could be that everything's looking better in all schools. And so without control schools that we can look at, we don't know if these impacts are just people love the programs that they do, because I've never been to a place where people don't love the programs they do, or do these actually change children's developmental trajectories? This is from the Doyle-Fosco article, which you can find in 2025, about a whole school mindfulness model in which there are steps of exploration, introducing the ideas, looking at alignment, doing communication, preparing staff, having champions, developing leadership teams, implementing over time, and they emphasize the idea for youth of voluntary implementation. Children can choose to do or not do the practices, and across all phases, accounting for context and identifying change over time and fostering integration with the rest of the school policy and practices, and working on the question, of course, of supportive leadership. Now, I don't know any research that's actually looked at a whole school mindfulness model and compared it to schools that don't have it. And to do this, we have to operate at the level of the school. So we need multiple schools in each group to begin to know if this is effective and if it can last. So just a little cartoon on this. According to the people in the R&D, the hard part was getting it to stay in the box. But the hard part is not what's in the box. The problem is when you open the box, what do people do with it? And this is the fundamental question, I think, for us is what do people think is in the box? What is there in the box? And what can we do with it when we open it? So schools can have shared practices that create communities of caring. There's no question it's possible to nurture and support kindness and altruism and empathy and compassion. But what is the process of doing this? It's not just being nice and talking about it, and it probably is not mostly sitting on a pillow for kids and having them watch their breath. It's teaching them a bunch of skills, these skills around kindness and altruism and taking other points of view and having compassion and providing feedback and recognition for that. And the best model of that is what's called the Seattle Social Development Model, where you provide opportunities for children to use the skills and receive recognition. That leads to bonding and attachment and commitment to their schools and their classrooms and their teachers. And that allows them to adopt the healthy beliefs and standards that our communities have. And that leads to healthy behaviors and caring as young adults. We have to have that. We have to have all those things in place, I think. And there are lots of practices that can facilitate empathy and compassion, in spite of the fact that I've said that the trials with teenagers aren't working. There are milieu models like the Golden Rule or noticing and remembering good things. There's SEL skill development. We know the SEL programs work. The question is not about SEL programs, but about mindfulness programs. We know there are contemplative awareness practices. There's lots of different kinds of meditations, compassion practices, storytelling, counsel procedures. There's a lot we can do in terms of service and volunteering with reflection, vigils and bearing witness, honoring others, viral strategies and social networks. All these kinds of things we think can build these practices, but very few of them have been studied. And many of you probably know the tree of contemplative practices. And this is important because we have somehow centered on the idea that mindfulness is an 8-session model where you do practices with your eyes closed. And that is one model of a contemplative practice. But there are many, 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 many forms of contemplative practice. And we know that different people with different personalities and makeups are more attracted to one of these versus others. And of course, it's going to be true for children and youth. For some children, contemplative art, contemplative music may be the most powerful. For others, it may be volunteering. And for others, it may be prayer. And so we have to really think broadly about this question. We have to stop testing programs that just do traditional mindfulness practices that in some ways sort of were adopted from the MBSR model for adults and were not really thought about sufficiently from a developmental standpoint. So when we talk about systemic SEL, or we think about whole school mindfulness, we say it's not one more thing on the plate, it is the plate. And that's the difference here. Oren Ergos talked about this as mindfulness of education versus mindfulness in education, an Israeli philosopher of education. And this is really important, that we think about this as systemic as possible, because I don't think we're going to reach the goals of creating schools that are healthy, caring, compassionate places only by instituting curriculums. Curriculums are an important part of this process, but they are surely not the whole process. We need to think about how children and adults regulate their emotions. This is the most important. This is the realm of the coin is emotion regulation. And what are the best ways for different children and adults to learn emotion regulation skills? For some children, it's probably martial arts or sports, and for others, it might be meditation practices. But we really need to have a variety of possibilities that children can engage in, that they're empowered to make choice in, if we're going to see long-term outcomes. Teachers and adults need to create healthy norms in a safe environment. Many teachers don't feel that their places are very safe environments now. And so this larger issue of what a school is like as a community is really important. And then schools need to adopt practices that create shared communities of caring. And there's lots and lots of ways to do that, from taking care of things in the neighborhood, service learning, reaching out to families, etc. So we can use high quality SEL skills, we can use mindfulness skills, we can practice caring and gratitude and compassion, but all of this depends on the head teacher leadership. If we don't have leadership in schools that believes that this is important, that this will lead to outcomes, positive outcomes for children, and by that I don't mean mostly mental health outcomes, because they are not very important to schools. They are a policy issue right now, but it'll come and go. I'm talking about academic outcomes, school success, showing up in school if you're a teenager, right? Because absenteeism is really a major policy issue right now, and academic success, feeling you belong in the classroom and performing well, which leads, unfortunately, to the measurement of test scores, but that is the policy parameter that's most often used by states and governments around the world. So I'm going to start with a broad agenda. I'm just going to come back to the broad agenda again for a minute, because I think we have to have a broad agenda here. The practical outcome of a comprehensive agenda would include clear developmental models of the growth of these things in children, effective policies, programs, and practices to support the development of caring, compassion, mindfulness, and service, and children or youth who show greater service to others, as well as caring about their environments. And I think we have a lot of work to do. We know a lot about what works for teachers. We know a little bit about what works for schools. And we are really, I think, still at the beginning of what works for children and youth, especially for teenagers. So with that, I mentioned I'm the chair of CREATE, where care in other programs are located, and you can find more information on us, resource pages, mindfulness practices, etc. And with that, I'll end and see if there's some more questions.
Thank you, Mark. I'd like to start with a question about the contemplative awareness practices. As you know, this summit is titled Contemplation by Design, and really in harmony with your insight about the over-focus and emphasis on mindfulness. What we have found is that mindfulness has gotten to be a recognized phrase in sort of the common language, but that contemplative practices is still seen as something that people are not sure what that refers to. And yet you're highlighting that it is important for education to recognize that the whole field of contemplative practices includes service and yoga and breathing and seated mindfulness meditation. What would you say to the question of increasing the conversation around contemplative practices rather than continuing to feed the focus and the narrowing on just the word mindfulness?
Oh, I'm totally in agreement with you. And Tia, I've mentioned Rob Roser a number of times, and he's phrased the new field contemplative developmental science. I think the word contemplative is a much better word, because I think the idea of contemplation or reflection, and of course that does presume in some way some metacognitive abilities, is a better phrase, I think, because it captures more of what we would see in the tree of contemplative practices, that the variety of activities and actions that you can take that can build contemplative abilities is so broad. And it's not to criticize anyone that much of this came from one or two Buddhist and Hindu traditions, but there are lots of traditions that we could be thinking of. We could be thinking of the Jesus prayer. We could be thinking about Japanese contemplative art, for example. There's contemplative practices in Native American communities, many contemplative practices. And there are contemplative practices everywhere in the world. And the question is, can we be broad enough that we can use a term like that and yet study the practices in a way that we can see which ones work? And that may be which ones work for whom and when,
Mhm.
which,
Mhm.
of course, when you add those two more interactive components of for whom and when, now we're thinking about studies that have to be large and have to be carefully designed.
Mhm. Mhm. Thank you for your reflections on that important use of language to help the field to continue to mature and move forward. You also highlighted that the programs that had been evaluated in teens did not include the focus on compassion and ethics. If you could say a little bit more about any program that you do know is addressing the fostering of compassion and ethics in a school setting.
Yeah, I think the Emory curriculum, and it's called C learning,
Mhm.
is a great example of that.
Yeah.
This is a curriculum that's been available now for a couple of years, generated out of Emory with the support of His Holiness, and it really takes a fundamentally broader approach where it focuses on ethics first of all, and as His Holiness wrote about in Ethics for a New Millennium, how secular ethics is critical to developing caring communities and democratic citizenry. And it adopts traditional mindfulness practices to some extent, but it does much more than that. It it also adopts many of the traditional social emotional learning practices. And we know that social emotional learning practices work. That's the field of in childhood that we know most about. There have been many studies. I'd say maybe 2 to 3,000 trials now. There have been multiple meta-analysis, all concluding that social emotional learning programs that teach skills of self-awareness, thinking about others, responsible decision making, interpersonal problem solving, managing conflict with friends, etc. These programs work. They're usually done across a whole year, embedded into the school curriculum. And we know that they have effects not only on children's well-being, but also on their academic performance. And this is why, in spite of the current political climate, which has been attacking social emotional learning, there's such strong data showing that the effects of teaching these skills to kids, and we don't need special teachers. We just need to train teachers to do this with good training, leads to very powerful outcomes. And so the question is, if we added mindfulness and compassion to these programs, to these kinds of programs, could we have even a stronger effect? And that's, I think, the fundamental basis of the C Learning program. That is, it's a strong social emotional learning program that also builds the secular ethics and a deeper focus on compassion. Another attempt to do that work is the Compassionate Schools Project in Louisville, and I think Alexis Harris is also one of your presenters. And that program, again, takes a strong social emotional learning stance and adds compassion and physical activity yoga to the program. It's only been tested in by use of physical education teachers so far, but it's another example of what you'd call a new look program that says we're not going to do mindfulness alone, we're not going to do compassion alone, but we're going to integrate it with what we already know works and see if we have even a stronger impact.
Mhm. Thank you. You had spoken about the teacher education and teacher certification, not of SEL or mindfulness certification, but just the general fundamental teacher certification in schools of education. Are any of those beginning to adopt the findings of the field that you're summarizing and presenting so that in the year or 2 years that the teacher is trained to become a teacher, are they being given exposure to what you were just referencing, that the cultivation of compassion and ethics along with social and emotional learning is a role that they are stepping into.
Well, I wish I could say yes.
Mhm.
I have to say that the schools of education are the slowest and most conservative part of the education system and the last to change, probably because the professors do the same things they've been doing for a long time.
Mhm.
That's my sense of it. And there are now social emotional learning classes in some states, and in some states they're actually required as part of education. That's a big change because in the past, teachers at most would get one class on classroom management, but nothing about how children develop their peer relations, how to teach them the kinds of skills we've been talking about. Um, but I don't think there are many places that have now carefully incorporated mindfulness into teacher training. There are some studies that are going on that are looking at the effects of teaching mindfulness to teachers in the pre-service years. One just published a nice one by Matt Hirschberg at the University of Wisconsin. But there isn't much known yet about this. My sense is that teaching teachers about mindfulness when they're in a training can be useful. But we have more motivation about using our mindfulness skills, I think, once we've been suffering. And let a teacher go out and be a teacher for a year or two, and their motivation increases dramatically for wanting to learn and use these skills because of the stresses they experience. And my sense is that in the pre-service years, it's good preparation, but I don't think it will be sufficient without some continued offerings in the in-service world.
Mhm. Thank you. And would you carry over that insight to the observation that the students who were mandated to participate in mindfulness curriculum, now I'm talking about high school students and middle school, preteen, and teens, if they were to be given the option to choose it based on their own self-identification of the need for it,
Mhm.
then that would be parallel to what you're saying about the teachers.
I think so. I think so. And when you look at what we call in education, we call tier two or selective interventions, that is where you only take kids that are high in depression or high in anxiety or high in rumination, there you see effects. Not always, but the effects are much stronger. And so that's not to say that mindfulness cannot help teens, but mindfulness programs that are universally slapped into the classroom in which teens are not voluntarily engaged are likely not to do very well because a lot of kids just don't like it at all. They find it boring and they'd turn off.
Mhm. Mhm.
But so that motivation is really the critical issue here. And it's true for adults too.
Thank you. We have another question. I feel so glad to know teenagers are flexing and asking all of us to see and hear them more fully. I'm reminded of Maladama Patrice Somme's recognition that teens' sense of belonging, being heard and mentored, is a whole community responsibility and requires culturally grounded, authentic practices that truly welcome them and prepare them to take on challenges of adulthood. This is a nod to indigenous practices that create strength in personal and communal navigation. Are you aware of programs that take this perspective?
Yeah, there are some, and I think it's a great question, and I agree with whoever wrote that question that if we can find practices that are indigenous to our culture in some ways, that they can be very powerful because they're not only teaching you skills, if you will, but they're teaching the skills in the context of engaging in historical cultural connections. And examples of that are the canoe work that's been done in the northwest part of the United States where I live with young people, where they go through the whole process of selecting a tree, uh, taking the tree down, building the canoe, and then going on these journeys for 1 or 2 weeks to potlatches. That's an example. In Australia, there's been a lot of work on drumming, for example, as another process. And of course, it's not just the drumming. It's not just the building of the canoe. It's the integrated processes of doing this as a community and talking about what it means. There's always a dharma, if you will, that's powerful for this. And when we think about any kind of practice, it doesn't matter if it's from a Christian or Jewish tradition or a Buddhist tradition or an indigenous tradition. There are always components to it, and one component is the practices themselves. Another component is the worldview, or in Buddhist, we might call it the Dharma, or if you're Catholic, we might call it about the homily or the sermon, right? That makes meaning of the practices. And then there's the Sangha or community. And we need to think about how all the three of those combine together so that the practices and the Dharma that goes with it, because the practices themselves, without meaning in a larger context, aren't terribly useful. And then how that's also related to the community that we're part of. And so indigenous practices for young people are a perfect example of a way to build contemplation.
Thank you. We have another question that asks about your comment about civic engagement and being a citizen in a democracy. And many institutions of higher education are launching initiatives to create more dialogue among the student body. And your slide in which you showed the Castle 5 domains and then mapped the contemplative deepening of those SEL competencies brings to mind the option for that framework to be included in these initiatives to foster dialogue. Are you aware of any example where that wonderful chart that you and Rob Roser have created being adopted?
I don't know of any studies that are just on sort of dialogic practices or dialogic listening. Of course, there are many organizations, given the polarization we have in our country, but not just in our country now, in Europe and other places, where people are learning the skills of communicating, like Marshall Rosenberg's work or the Braver Angels work, that bring people together to practice skills of dialogue across political differences. And I think some of those practices, as you're saying, have been now adopted in the universities and colleges as a way of, again, doing that same thing of bridging these polarities. And those are powerful skills because being able to listen without judgment to someone that you completely disagree with, um, what does that do to your emotional arousal, right? And so the ability to regulate yourself under those conditions and really listen and hear another person's perspective that you may completely disagree with, that's a powerful skill, and one that in a democracy, it's critical for us to develop, and which has been lost probably in part because of the power of social media.
Hmm. Would you say more about the role of social media in thwarting some of these competencies, or at least putting an obstacle in the arc of a child's mind's developing?
Well, just to say that there are so many competing things that are competing in children's mind these days, and social media, of course, is the major one, but it's not just the kids, it's us too. Who doesn't watch reels? Who doesn't do this, right? Almost all of us do it these days, and they can capture our attention when we could be doing very different things. And that's true in schools. This is why the work of John Haidt and others of removing cell phones during the school days, of restricting cell phones to younger children, especially that access the internet, I think are really important. The issues of social media, as many of us would probably agree, have gotten out of control for us. Uh, Maybe not as damaging it is for kids, but for kids, we need a new set of policy frameworks. And this is, again, not just a United States issue. This is a worldwide issue. UNESCO and others, OECD, have been working on these same issues internationally. And I'm sure that they reduce the development of many of these skills because kids are spending so much time on media rather than being face to face.
Mhm. Are you aware of any policy statements, perhaps by the Association of Pediatricians or the National Institutes of Health related to the development of the mind and guidelines around lifestyle circumstances that would help to develop the mind?
Yeah, well, the American Association of Pediatrics has made statements, quite good ones. I don't know about other organizations. I'm not really involved in all that, although I've been going to meetings about the role of AI and education and social emotional learning, and this is another area in which we don't know much yet. We know that AI developers are developing all kinds of selective interventions. You know, teens having chatbot relationships. And while some of these may be beneficial, most of them are unlikely to be beneficial because chatbots are programmed to make you feel good by relating to something that's not actually human. And our problems in our world are in a way about how we relate to humans. And I was just in Bogota, Colombia, where I saw the president of a major university there talk about the influence of AI on college students. And she said that this is the most important time that we build the human into humanity. And we make sure that our institutions, our colleges, our schools really focus on what's human about us and all our foibles and difficulties and potentials, because AI will appear to be something that it's not all the time, in which we actually feel we're actually communicating with someone,
Mhm.
but we're communicating with a large language model that is only predicting each word after the previous word.
Mhm. We thank you for your wisdom, your depth of dedication to these important topics, and we look forward to following your work in the future and are grateful to you for all that you have elevated and illuminated for us in this session. Thank you.
Of course, my pleasure.